All right, so phlebotomy. Why do we draw blood? Then we have a couple pictures or questions like this. Analysis. Why do we get data on people? What were some of the reasons that we would look at urinalysis or just draw labs on people? Chapter 29, we talked about introducing the clinical laboratory. What were some of the reasons that we drew blood and did labs on people? Can anybody tell me?
To test your levels of medication, to test levels of medication, to test the hormone levels. Could you hear me? Yes.
Yeah, I could. That was Linda?
Yep.
Yeah, good choice, or a good answer. Like to monitor, right? Did you say monitor? I didn't hear that part. Monitor maybe a certain sickness?
Yeah, to check his hormone levels. Yep.
Monitor medication levels, find a diagnosis, things like that. And there was a difference between, remember we had, let's see here, qualitative data and quantitative. Brittany, you remember an example of qualitative data?
Nope.
Anybody?
We can go with quality.
You weren't here for this, Linda. You're way out of the loop on this one. What about you, Shonda? What's an example of qualitative data?
Trying to think. My mind just went blank. I know quantitative is the exact amount, like number-wise.
Yeah, it's
chemistry,
a number.
ain't it?
Huh?
Usually with chemistry.
Yeah, usually chemistry. So it's a number, exact amounts. If you were to look at an example of a quantitative right here, quantitative data number, it would be like white blood cell count, 100,000 per cubic cc. Whereas qualitative just tells you yes or no. What's the quality of the sample? Okay, wait a minute, I won't do that one. I'll say, so like when bacteria are in your urine, they're eating and they're producing waste. One of the waste they produce is nitrates. And so it'd be like on the lab sheet, it'll say nitrates and it'll be yes or no answer. Yes, they're present. So if they're present, there must be bacteria there. That's quality. This is quantitative. Now, if they cultured these bacteria and they were looking at a microscope and they were counting them, they might say bacterial colonies of 100,000 or more or something like that. So you need to make sure you go back to chapter 29, specifically page 1. Right at the beginning of the chapter. Yeah, pages 753 through 756, basically. The beginning part of that chapter it sums up on almost all of it that you need to know. But we will review that before we have a test, okay? Just kind of a little review there. All right, so we're looking at phlebotomy slides here. Intro to phlebotomy. couple different ways you can get blood out of someone. I would also make note that this word phlebotomy is a test question. It literally means if you were to take this word and cut it in half here. Let's go with red. Why ain't my pen working? Guess we'll do it like this. Well, anyways, this prefix phleb means vein. It's the Greek word for vein. And otomy means to cut. That's a test question. It's going to come up again. To cut a vein. It's not to pierce a vein. It's not to take out blood. It's to cut a vein. There's two different ways you can do that. You got from the veins. This is deoxygenated blood returning back to the heart, right? Veins are more superficial. They're more towards the surface of your skin, and they're not as deep as arteries. And then you have arterial punctures, and guess where that blood comes from? An artery. And the reason you'd be doing that mainly is to check blood gases, things like that. Shonda, as a phlebotomist, she's allowed to do arterial punctures as long as the hospital allows it and she's been trained to do it. A lot of times you go right here into the radial artery to draw arterial blood gases. They'll numb it up a little bit, and then they'll put a bigger needle in there and go kind of deep and get that fresh artery blood on its way out of the heart. But there's a lot more risk involved with that, because what happens if you get an artery angry or sick or infected? What's going to happen to everything downstream from it?
I want to go into the system.
Well, if this blood flow is compromised here, what's going to happen to this body part?
Die.
Yeah, it could potentially become necrotic. So you got to be a little bit more careful about that stuff. Venipuncture, though, I'll tell you what, I shouldn't be telling you this as a teacher, and I'm recording this lecture to send to Tiffany. I've done thousands of IVs, and I think it's pretty safe procedure. You basically use alcohol to sanitize stuff. And other than that, I mean, people do IVs out in the field in wartime. You know, they're just sticking needles in, stuff like that. You can do a lot without really causing a problem there. Some of the things you need to know to prevent a catastrophic problem from just a regular venipuncture is your anatomy, what you're feeling for, and prepping the site and taking care of it afterwards. Kind of those 4 areas here. Before you even stick the patient, you want to make sure you as an MA have your stuff lined out. You're going to bring your patient back to the lab, right? Some doctors' offices will have a little lab in their office. When you set that patient down, you don't want to be fumbling for stuff like, oh, where's my needles? This is the wrong size. That's the wrong material. Because that just makes the patient what if you're fumbling? What are they doing?
Getting nervous. Think you don't know what you're doing.
Right. They're anticipating a needle stick. You know that's why they're there. And they know that's what's getting ready to happen. So the longer you delay, they're just getting more anxious and things like that. You want to have everything ready to go when they walk in the room already. You want to make sure they're in a certain position. If they're standing up and they pass out, that's going to be bad for them if they fall, right? So you need somebody sitting down or lying down. Make sure your tourniquet's placed in the proper location and you don't leave it on for too long. There's a couple different problems that can cause, not only injury to the patient, but problems with your sample and OSHA, because what's the big risk here when you're drawing blood?
Exposure, needle stick.
Everybody agree with that? That's the biggest risk exposure here in this task you can do as an MA is being stuck by needles. And apparently nowadays catching coronavirus because you'd be breathing around them. So some of the things before you even sit the patient down in the chair, you've got to make sure this these patients know what they're doing and what they're getting tested for. Have we spoke about this, about fasting and stuff? Seems like we have in clinical laboratory. We talked about, have they been given education and directions on what they need to do to prepare? Did you make them acknowledge your instructions? Did you chart that? That way when they come in and they're like, oh, I had breakfast this morning, they're supposed to be fasting, you can chart, we instructed you to not eat. You can be like, look, it's right here. We had this conversation. Know what you need for your test. Identify the patient. How many, not Shonda, how many identifiers do we need for a patient? 2, Linda? And what are those got to be usually? One was social security number, date of birth, name. Those are all identifiers. You need to try at least 2 of them.
Did we say name and birthday?
Yeah. If you're in a hospital setting, which you may never be.
That's what I said was name and birthday. Was that not right?
No, that's right. But there's potentially more chance of somebody having the same name and maybe the same date of birth than there is the same name and the same social security number. So sometimes it might be wise to just do social security number and name or medical record number. But these are all test questions. Going to come back to chapter 29 later, stuff I'm talking about right now. Make sure you get your site. We're going to talk about the anatomy underneath where you're drawing, what these landmarks are, these veins, how to find it, and how to choose your site. Some of the tricks of the trade to make these veins appear more prominent or to access them a little bit better, because not everybody's an easy stick. Let me go grab a tourniquet real quick so I can show y'all something. You can still hear me when I walk away. I'll be right back. You guys find your, does anybody got their book out in front of them? Does anybody got their book out?
Do you need me for anything else before I leave this?
No.
All right. Have a good evening.
All right. We'll see you later.
All
I'll
right,
see you
bye.
on Wednesday.
Okay. Same time?
Yep.
All righty. See ya.
See you.
What chapter is it?
31. I'm looking at page 819. So here's some guidelines you need to write down if you're taking notes. You should be taking notes too. All right, Sean is gone. Let's party.
I'm gonna die of starvation between now and there. Just this. And bored.
I'm trying to think of some test questions we've had. I'm looking at the bottom of page 819. It says guidelines for applying tourniquet. These are a bunch of questions. You need to make sure you study this section here. Page 819, it says tourniquet should be applied 3 to 4 inches above the site, right? So that means if I'm drawing from this antecubital space here, we're going to go right above there. Okay. Not way up here. Not right here, but 3 to 4 inches above it, right? Look in your book and tell me, Brittany, you got your book out? Tell me how long we can leave this on.
No longer than a minute.
1 minute. Now, I've had my blood drawn before, and I've drawn lots of blood, and I've left this on longer than a minute. Sometimes I've left and forgot it was on the patient. Honestly. Like, why isn't this IV flowing? What's going on here? Oh, it's because I haven't taken this off yet. Don't make that mistake. especially if you get a little lady or somebody who's prone to bleeding and stuff, you can really mess them up. Why would we want their fist clenched before you put this on? What's happening when we put this on the arm? What's happening to the blood down here in this part of the arm?
It's sort of stopping it, isn't it?
It's keeping it from flowing that way, right?
Yeah, it's stopping
Yep.
it.
So if you clench your fist, the blood that was just freely flowing in your palm and in your fingers and these muscles in your forearm, if you clench it, that blood is kind of pushed up here for a second. And when you put this on, okay, you're trapping that blood up here. And it's, instead of, you got more volume blood in here after you've got it strapped on. That's the reason to do that. You don't strap it on and then say, okay, do this. It's clench and then put it on, because when you clench, that blood is kind of forced up in here, and then you can relax after that. If you do it afterwards, it's not really no point in that at all. Always remove before removing needle. This happens to a lot of people when they're initially learning how to draw blood. I was in the Air Force. I was in Guam. And I was sick. I had like a fever and stuff. I went to the doctor, and this nice young doctor lady was drawing my blood. She had a pristine white coat on. And I was laying in there, and she drew my blood and took the needle out before this had come off. And so all that blood that was being pushed up in here all of a sudden shot out and just covered her pretty white coat and face in my blood. There's a lot of pressure in here. When you take that needle out, it's just going to shoot out everywhere. This has to come off before you're going to have a mess on yourself. I would make sure I noted a couple of these things here, though. 3 to 4 inches, 1 minute, no longer. You don't want it too tight. You want to make sure you're putting it over a site that's not compromised here, okay? Those are all kind of test questions. Make sure your lighting is good. That is one of the best things you can do. And you want to make sure you can actually feel or see veins. Sometimes right here it says use AC even if you can't see. You can't always see a vein here in your antecubital space. A lot of times you can feel them though. And it's saying if you can feel it, that's where you should get blood drawn from, even if you can't see the vein. Here's the biggest thing I see students do. They're like, they'll feel, they'll be like, okay, that's where it's at. And they'll want to stick the needle in while this finger's still right here, because they don't want to lose where they were going to stick the needle in. You should feel it, kind of keep your eyes on the spot, and then just stick it. And most of the time you'll hit it. You don't need to be doing this like my finger's on it and I'm trying to stick a needle in there and feel it. You feel it, you let go, and you just stick it. That's the way it goes most of the time. And but it's a bad habit students develop early, and they try to it's hard to break them from it. What's wrong with that scenario?
You might stick yourself.
That's right. You're prone to